This is Juan. At a young age, he trained and competed in powerlifting competitions. Powerlifting competitions consist of testing one's strength by maximizing a 1 repetition maximum for 3 lifts: a back squat, a bench press, and a deadlift. Many other Olympic lifts are used in training for these competitions. About a week ago, Juan had a huge competition in Orlando, Florida. While performing the deadlift, Juan felt a sharp pain in his lower back, causing him to drop the barbell and fail the lift. Juan is not the only powerlifter to experience these kinds of problems. Oftentimes, powerlifters will lose balance or fail to complete a lift because they are moving such heavy resistance at a high velocity. This makes powerlifters very susceptible to injury. He was very disappointed since he felt well trained for the competition. After just resting and using a cold compress and heating pad to relieve pain, Juan still did not feel better. He decided to go see Dr. Power and see what the problem is since he is very eager to get back to his training. After examining his back and performing an MRI on Juan's lower back, Dr. Power discovered Juan had a herniated disc between L3 and L4 in his lumbar spine. Dr. Power suggested to Juan to go to physical therapy to learn more about the injury and how important it is to have proper technique when performing these lifts. Juan immediately went and saw a physical therapist, Anna Robic, to start his treatment. Being the intense athlete he is, Juan asked Dr. Robic what this means and if he would still be able to perform his lifts. Dr. Robic explained that before understanding what a herniated disc is and if he will be able to perform his power lifts, Juan must first understand how the lumbar spine should normally function.
Your lumbar spine serves as one of the central building blocks of the body's core. It is essential for maintaining proper overall function of your spinal column and providing a stable base for your body to move. The lumbar spine has 4 main functions: stability, mobility, maintaining upright posture, and protection of the spinal cord. The thick vertebrae of the lumbar spine are necessary to support the weight of your body and any additional compressive loads placed upon it. They allow you to perform coordinated, purposeful movements safely and forcefully. The lumbar spine interacts and depends on other joints in the body in order to function properly. It depends on the hip and the pelvis due to the many ligament and muscle connections they share. The sacrum provides the lumbar spine with a base for stability, which allows for weight distribution to be transferred through the lumbar spine to the pelvis. The thoracic spine also assists in weight transfer. A herniated disc occurs when the intervertebral disc cannot withstand any further pressure. This impacts the outer portion of the intervertebral disc, called the annulus fibrosus, which causes the inner portion, called the nucleus pulposus, to protrude outward. When it occurs, it can cause an increase in pressure on the spinal nerve, which could cause pain in the lower back and sometimes legs, muscle spasms or cramping, and leg weakness. Due to this pain, patients may avoid use of the lower back muscles, which may lead to shortening. As part of a physical therapy treatment program for Juan, we want to focus on improving his mobility and strength in his lumbar spine and hips. In addition to exercises, we want to educate Juan on proper lifting techniques to prevent further injury on his back and optimizing his powerlifting.
Our interventions will consist of exercise programs specific to Juan's training goals to rehabilitate him as quickly as possible in a safe manner. This will allow Juan to return to powerlifting competitions with proper technique and appropriate weight. Juan will leave physical therapy with anaerobic feeling like he received a high-quality, goal-specific, patient-centered rehabilitation program.